And so Hannah joins us from Vienna, I think, or at least the University of Vienna. I was introduced to Hannah by Andrew Oswald, who was really, really, really impressed with with the working paper that came out. And so he said, Jan, you might want to look at this paper and see if Hannah may be willing to present it. And so we're very fortunate to have Hannah join us for that. And so Hannah, over to you. It's about collective emotions during COVID-19. Over to you. Thank you.
Thank you. I'm really pleased to be here today and really looking forward to the discussion later on. So I share my screen. All right. You should see it by now, right? Yeah. All right. So I'm going to talk about a study we did about a year ago. Also, we're still busy with it every now and then. On basic emotions from a psychological perspective during the outbreak of COVID. So that was basically the first 5 weeks or so after cases really started rising in each of the countries. And we were actually quite a big team involved because we collected data from lots of different countries. I'll get back to who did what at the end of the presentation again. And so just a bit of background, I'm a psychologist. I'm now working computational social science, and I don't know what all of your guys' background is. So I just want to give a quick intro on why we chose to look at the emotions we looked at and why they might be important to behavior during a pandemic. So I think the case of anxiety is pretty clear. Probably most of you felt it as well in the early days of COVID-19. And so basically it occurs when people don't have clear explanations for what happens, when they're really uncertain about the future, and when they feel unable to cope with threat. And there's a number of papers showing that it could be really relevant to behavior because anxiety directs attention to danger. It affects risk perception and compliance, and it can also influence unadaptive protective behaviors like people stockpiling food or not going to the hospital, although they should. So for anxiety, I think it was pretty clear. The hypothesis was pretty clear. We expected just a large increase. For anger, it's a bit more tricky. It usually occurs when people are exposed to negative conditions, to some boundaries, to when they can't get to where they want, and when there is someone to blame, or when they perceive someone that they perceive as responsible for whatever happened to them. And so anger is, of course, really important because it can undermine trust and reduce compliance, which is, I think, what we partially saw later on during the pandemic. I don't know exactly how things were in the UK early on, but at least in Austria early on, things seemed to work pretty well still. So for anger, we did not really know what to expect, but we were kind of expecting to be able to interpret it as an overall acceptance or not of measures of government actions and the like. With regard to sadness, it occurs when an important goal is frustrated. So when people lose something or are separated from someone. And its function, or at least one of the functions that psychologists have described, is that it motivates us to seek support, to seek social connection. And finally, we looked at positive emotions simply because we know that they can reduce stress and depression. So they might be kind of a sign of resilience, and that they can foster effective coping and trust during the outbreak of a pandemic. So before I actually get to our specific study, I want to just kind of make a number of remarks on why social media data is valuable to assess these kinds of things, because of course, in comparison to surveys, it's much harder to get representative samples. It's not even possible usually. We can't measure people's direct emotional expressions. So we cannot ask people how they feel. We can just really make indirect conclusions from whatever they're writing on social media. So why are social media data still relevant? In some cases, at least. First of all, they're really super cheap, and it's very efficient to get them. It's much more costly to run a survey. And then they offer a number of advantages, like the frequency of data that we have. We can assess hourly changes in the current, even in the current study, we use daily volumes of tweets. we had a lot of historical data, which allowed us to compare to a period before COVID-19 and to even correct for a baseline in 2019. And then I think one advantage that is not so obvious is that when we're investigating emotional responses to a particular event, starting a survey takes time, and people have a hard time remembering how they felt even a couple of weeks ago. And so when we are analyzing social media data, the data is more indirect, so we measure emotions more indirectly, but there are no emotional memory or reporting biases that could influence what we measure. And finally, using social media data allows to include some people that are hard to reach with surveys, like, for example, non-English speakers or people from lower income countries, which is a thing we did in the current study. So social media data have their disadvantages, but I also think that they really have something valuable to add to representative surveys. Now, let me quickly explain what we did before I get to the results. So we basically just looked at expressions of emotions on Twitter. We used a standard method in psychology, at least mostly. We also used some machine learning methods to validate what we did to see if we got similar results with that. But we mainly simply used linguistic inquiry and word count, which means you match the text of tweets to a list of words that express a certain emotion. And we used validated dictionaries here for fear, anger, sadness, and positive emotions, which exist in 6 languages, which is, or they exist in more, but we use them in 6 languages, which is one of their advantages. And this allowed us to include 18 countries on 4 different continents and a lot of tweets in total. So we only looked at original tweets, not at retweets, because we were interested in people's emotions and not in which emotional tweets, for example, would get retweeted more. We only looked at users located in these 18 countries, and we used follower limits to exclude bots and mass media. And then we basically look at the percent of tweets per day that contain at least 1 emotion word from each of the dictionaries, and we compare the change to the 2019 baseline per weekday. Now, I picked 2 countries that I thought would be of most interest to you to show you just the timeline examples for the different emotions. There's quite a lot to see on these graphs, so let me guide you through them. In yellow, you see anxiety, and you can see, I think in the United Kingdom here, not so in Ireland, I'm not so sure, you can see a first little peak in anxiety when the first cases occur. You see cases in gray, it's the little circles in gray. Death are the little squares in black. And you can really see that as cases rise and as measures get strict, so the measures are the line in black, anxiety really increases dramatically. So this is not something you usually observe on social media, up to, I think, something like 60% in both of the countries. A little bit later, you see an increase in sadness expressions or in tweets that contain sadness expressions, which is pretty much at the time of a clear increase in the stringency of measures. And then at the same time, you see a decrease in the expressions of anger in most of the countries, which is in red here. You can also see that basically for positive expressions or expressions of positive emotions, not much happens. In these 2 countries, you see a little tiny drop, I think, in Ireland at the moment at which the stringency of measures really clearly increases. At the bottom of the 2 figures, you basically see the time periods we analyzed with a statistical model later. So this is a control period of 1 month in January and February. And then you see the 5 weeks after the outbreak, and the outbreak is simply defined as the day with 30 cases in each of the countries. So these are just the periods we used for the statistical analysis. All right. So because I can't show you all of the country, I want to at least give you an idea of how consistent these effects were across countries. And the increase in anxiety across the 5 weeks that we analyzed was really present in all of the countries. The increase in sadness still occurred in most countries. It was not significant in Germany and France, I think, but all the other countries. The decrease in anger still occurred in many countries. We just had one country, I think Spain, that showed a trend in the opposite direction. And then finally, for positive emotions, we observed different patterns across different countries, but the change overall is really, really quite small. I think maximally -5% or something like that. And now I'll get to the statistical analysis I spoke about. So basically, we used the generalized mixed effect statistic regression model to also model for random variations between languages and countries. And what I show you here is just the fixed effects coefficients from each of the models. So the effects that were common across countries. And what you can see for anxiety is really a very rapid and strong early increase at the very beginning. And then levels stay stable for about 2 to 3 weeks before they gradually decline. For sadness and anger, we see much more gradual changes. And finally, again, positive emotions drop a little bit in week 1 in some of the countries. That's why this shows up here, but not much overall. Now, we were also interested in which factors might be driving what we see. Of course, I need to really point this out here. Although we had a lot of tweets in total that we analyzed, the number of countries, it's also quite high for a social media study, because usually these things are done for a country or a couple of cities or something like that, but it's still just 18 countries. And so the correlations I'm showing you now, they were really exploratory. They make sense, I think, also when one observes the timelines and what happens at what time in which country, but still there is a need for caution in the interpretation of these. And so basically, we see overall, if we take an average of how many COVID-19 cases there were in the 5 weeks after the outbreak, and also the average anxiety level during those 5 weeks, we do see quite a considerable correlation. And it's even stronger in some of the weeks, especially at the very beginning. So in week 1, after the outbreak, this is really when you see for the first time a clear increase in cases. This correlation is even a bit stronger, which is here clearly influenced by the countries that had the strongest growth in this week 1. We also try to look at the stringency of measures. So here and their possible influence or association with emotions. The picture is a bit more complex here, so the correlations aren't all as strong, but they're really also reflecting what we observed in the timelines. You might remember that the anxiety really goes up a while before stringency increases and then drops off later on. And if one looks at this systematically across many countries, I kind of feel like I see a pattern of anxiety dropping as soon as the strict measures are in place in all of the countries. And so this is kind of what we also observe when we correlate across countries. We see a slight increase at the beginning, possibly people being afraid of what's coming with the measures. And then we see a consistent decrease over the next week. I'm not showing you the later weeks here because by that time, there was not a lot of variation in stringency anymore. Most countries had adopted very stringent measures by week 4. For the other emotions, I'm just going to show you the correlations that were most interesting. So anger really seemed to drop as stringency of measures increased. Positive emotions showed the clearest correlation. As I said, positive emotions really only dropped in a couple of countries and only for a brief time in this first week after the outbreak. But in these countries also happen to be the ones with the more strict measures already this early on. And finally, for sadness, the pattern was clearest in week 2, where we saw kind of a moderate correlation with the stringency of measures. So the more people had to stay at home, the sadder they were. Now, one of the most impressive results that we did not expect, we didn't predict it, we just really noticed when we looked at the time series that the emotions did really not go back to the baseline for a very long time, for longer than one of our collaborators who has really been working with social media for years, for longer than he has ever observed. And I want to just show you this with 2 examples, anxiety and sadness. So you basically see in gray the amount of days, the number of days in a row during which emotions were above the baseline consistently or below the baseline consistently. So for how long these changes were lasting. And then you see as a little circle always the maximal length, so the maximal period that occurred across all of 2019 until the first COVID-19 case occurred in 2020. And then you see in red just the length of the duration after the outbreak, for which anxiety did not go back to the baseline. And this is really a month and even a bit more in some of the countries, which is really something that usually doesn't happen before. I think the only exception here is Chile, in which there were protests against social justice, for social justice and against violence against women in the year 2019. For sadness, this is still the case for many countries, although it's a bit less clear, the pattern, but still most of the countries really experience the longest change in emotions since we have social media data. Now, one of the ways to interpret this is, of course, one very obvious one is a pandemic is a really long event. There's lots of stuff happening all the time. And we think that this is, of course, it's partially true. But in addition, we also think that what happens during these kind of large scale societal events is that people talk with each other about their emotions and about what's happening. And these social interactions prolong emotional responses. That's what we know from other studies after the terrorist attacks in Paris, for example. And we think that this could play a role really with what we're observing on social media, that it's not just people are afraid at the beginning when cases rise and when measures become strict, but that this really lasts for more than a month, could really also be socially driven because people continue to reactivate each other's emotions. And now finally, I want to just give you an idea of the raw data to also show that the words we're measuring here are really actually relevant because it seems a bit magical. We just count words and then we show you these timelines. But I think the words really show that people did feel emotional about COVID-19 and not just about random other things. So here in gray, you basically see just the words that were the most frequent in the US in total. And then you see the most frequent words in tweets belonging into each of the emotional categories because they contained an emotional word. And so there's lots of people that are frequent in general, like I think people here, for example. And if I take those out from the graph, I think what's left really shows you a clear picture of what people were emotional about. So we really have words like risk, panic, fear, doubt, the virus. In other countries, we have health. We have the measures in some of the countries too. With sadness, we see words like miss, lost, alone, hurt. So it looks like this is kind of related to social distancing. I think we have the word social distancing in some of the countries as well. I think the anger words also speak a really clear language here. And finally, with positive words, you might notice that these are really general words. So it's not like expressions of happiness or something like that. Most of these words also occur in tweets in general. So I think the positive emotion dictionaries we used are kind of, they're probably a bit too broad for my taste. And this might also be why we did not observe a lot of change in positive emotions. So if I summarize, we saw some of the longest observed emotion changes on social media in many countries that have been observed until today. For anxiety, we observed strong initial increases that was linked to both measures and cases. We then observed a gradual decline, which could just be a sign of people habituating, learning to live with the threat, with the new situation, but could also reflect a sort of a relief after the onset of measures, people having the feeling that finally someone was doing something about the situation. With regard to sadness, I think that the most likely explanations we really see, also because of the correlations with the stringency of measures, the loss of social contact, and the loss of daily routines. An obvious other candidate, of course, are death, people simply losing people that are close to them. I think this is quite unlikely in this early time period because there weren't actually that many deaths in many of the countries we looked at. With regard to anger, as I said, we kind of looked at this as how much do people complain on Twitter compared to how much they usually complain about political stuff, because Twitter is quite a political discussion forum. And it seems that they complained about 20% less in many of the countries than they did in 2019. So this could simply be a sign that there was less discussion of other controversial topics than about the measures. So the measures were maybe at this early point in time less controversial than other political stuff. Another idea we have, but we didn't test this, is we've seen reports of lower crime rates during the first lockdown period. And because anger also contains lots of words related to violence, this could also just reflect less talking about these violent acts. And finally, the positive emotions seem to suggest at least a certain amount of resilience during this early time period. So we think that basically what these emotions are most relevant for, or what these kinds of analyses are most relevant for, is being able to quickly measure emotional states in the population in general, of course, at a very superficial level. And that we think that this is super important to then actually communicate with people in an efficient way, which is super important for compliance, etc. in the long run. So with this, I want to thank you for your attention, and especially David, who also did part of the analysis with me, and all of the other co-authors. I put a couple of links here, and I can also put them in the chat later in case you're interested in looking at other countries or in looking at the one case, Austria, that we actually analyzed until today, where we have a dashboard that continuously updates itself. And now I'm super curious to questions, criticism, anything you might think of. Oh.
Hannah, thank you. This has been an amazing presentation and super impressive work. Thank you ever so much.